Well, hello, hello, hello. Welcome to SHEM Ministries. That is Souls Honoring Elohim's Mandate. And tonight is our SHEM 2 night. And those of you who know me know that this is not the classic video broadcast, right? To God be the glory. I am currently in a hospital waiting room. I stepped out of a hospital room in which a family member of mine um, is admitted to the hospital. But I wanted to take the time to say my heart's desire is to present something to you tonight on my normal Shem 2 night. That is what? A spiritual, healthy, enlightening mandate ministry. So please forgive me for things not appearing as they normally would. Topic for next week, which stems off of last week when we talked about vascular disease. And because of the fact that two things happen in the month of February. First of all, February is Black History Month, number one. And February is also Heart Healthy Month. So I have decided that next week we are going to focus on um, heart disease in the African American woman. So the Black woman, the which will fulfill our desire to talk about and acknowledge Black History Month, and then also talk about women. We want to talk about the role of um, African Americans in regards to heart disease. And I also want to talk about the rate and the statistics for African American women when it comes down to um, the disease itself, heart disease itself, and mortality. So we want to talk morbidity, death rates, and mortality. Um, you know, um, but tonight I wanted to take, like I said, I'm a little compromised in my ability to present as usual because I'm still in the hospital. I intended to be home and able to present, but that did not happen. So here we are. Um, but what I wanted to go through a few statistical things and use this little short segment as an introduction. And so the first thing that I want to introduce to you is on last Friday, and please apologize, I'm holding my phone myself, okay? I don't have my tripod or anything, so please bear with me if I'm in and out of screen, right? But last Friday was what we called National Wear Red Day, and that was Friday, February 2nd, and nationwide we were to have worn red in honor of women and heart disease in women. But I say to you, let's not let it just be one Friday. How about every Friday of the month of February? You know, it's a short month. Can we not do this? Can we all not wear red one Friday one Friday? I mean, every Friday in one month. That's what I meant to say. So I challenge and charge each of you to wear red every Friday of this month in honor of heart disease in women, because, well, honor of heart disease in African American women, because this is Black History Month, right? So let's really think about our Black women, okay? And the strength that we have had to have, could that strength kind of masked our ability to identify that maybe we were having a heart attack or a stroke? Or we spend so much time taking care of other people that we ignored the warning signs in ourselves. We couldn't get weak. We had to take care of someone else, right? Isn't that something to think about? So let me just read a few things to you, and as an introduction, as to what we're going to talk about and focus on. Um, so don't forget about National Wear Red Day. We're going to make it National Wear Red Day for the whole month. Okay, so that's my challenge to you. But listen to this right here. Since 2004, actually, the American Heart Association's signature women's initiative is Go Red for Women. It has addressed the awareness and clinical care gaps of women's greatest health threat, cardiovascular disease. They are prepared to meet the evolving needs of women now and at every age, every stage, and every season of their lives as their trusted, relevant source for credible, equitable health solutions. Wow, that's good to know. And that is the American Heart Association. Okay? So if you've never gone to their website, I do want you to know, if you click on the website, the first thing they're going to ask you for is donations. Nothing can be done without financial resources. And so that statement that I just read to you, relevant sources, think about that. Relevant source for credible, equitable health solutions. That takes money. So does it sound like I'm pitch, a pitch for donating to the American Heart Association? We donate to everything else. Why not? Why not? Tax exempt donation to the American Heart Association, especially if those resources will fund something so that we women can stay alive longer. And next week, we'll talk about how that impact on African American women. Okay? So let's keep talking real quick because I want to go through some statistics. Please forgive me. I'm holding my phone. I want to go through some other statistics with you. Now, listen to this and listen well. Cardiovascular disease is the number one killer of women. 1 in 3 women, okay? That is how prevalent it is. It's not always been that way. It used to be men, but women. Let's not talk about what we do. And I'm not knocking men because there are some men that wear more than one hat, but historically, it's the woman that takes care of the home, actually takes care of the children, takes care of the husband, work, and don't gripe and don't complain. And we know that stress is a big factor. Okay? So, cardiovascular disease is the number one killer, number one of women. Please keep that in mind. The next statistic is nearly 45% of women over the age of 20, okay, come on now, not 20, over the age of 20 are living with some form of cardiovascular disease. Remember last week when we talked about vascular disease? and I talked to you about um, peripheral disease and cardiac disease, think about cardiovascular disease, including hypertension, okay? Elevated blood pressures. Cardiovascular disease is more than just having a heart disease. There's a lot involved that we should not ignore, okay? 45% of women over the age of 20. Wow. Next statistic I want to mention is heart disease is the number one killer of new moms as the leading cause of maternal mortality. Now, I hope I got that right earlier. Mortality is death, morbidity is disease. And if I mixed it up, please forgive me. Okay? Mortality is death, morbidity is disease. Having heart disease. Mortality is dying from it. So you're telling me that the number one killer of a new mom as the leading cause of maternal mortality. So if a woman were to die with childbirth or after having childbirth, they're saying that heart disease is the reason. So that 20-year-old woman may not have known that she had heart disease and she was having a baby, and the greatest time in her life, and she dies after having a baby. You're telling me it's because she had heart disease and didn't know it? Number one reason that women die after having childbirth. Is that what you're saying? Yes, that is exactly what I'm saying. Next statistic. Women are less likely than men to receive bystander CPR and less likely to survive an out of hospital sudden cardiac arrest. What is that about? Are you telling me that if a bystander saw a woman down on the ground, unresponsive, she would be less likely to get CPR than a man? I wonder what that's about. Is it fear of you can't touch a woman? Because if you touch her, she may think that you're trying to do something inappropriate. Do you think that could be the case? Well, we're going to find out. But can you believe that? That a bystander would rather do CPR on a man than to do CPR on a woman. If there were signs of cardiac arrest, which would be unresponsiveness, is it the fact that she has breasts? You don't want to do chest compressions because she's got breasts? And if you touch her breasts, maybe it would be taken as inappropriate behavior? Wow. We got a lot of work to do. A lot of work to do. The next statistic is there's only 38% of cardiovascular clinical research trials participants were women as of 2020. Is it because women don't feel that, or is it because we've always been taught that men die faster, or it's more likely for a man to die with a heart attack than a woman? Not anymore. And we don't think it's important for us to participate in clinical trials? What's that about? It's time that we acknowledge that we are dying with heart disease and we need to do something about it. So participation has to change. It has to change because clinical research trials are how we find out the things that we need to know about medication, our response to treatment, our response to therapy. So we have to participate. There's no if and buts about it. But that was as of 2020. Only 38% of cardiovascular clinical research trial participants were women. Wow. All right. Now, the last thing, and like I said, this is going to be a short segment tonight. I want to give you something to think about between now and next week. I want to talk to you about the difference between cardiac arrest versus heart attack. People often use these terms interchangeably, but they are not the same. What is cardiac arrest and what is a heart attack? Well, cardiac arrest occurs when the heart malfunctions and stops beating unexpectedly. When a person has a heart attack occurs when blood flow to the heart is blocked. So, but can a heart attack lead to cardiac arrest? Yes, but they're not the same. So, when a heart attack occurs, this is a circulation problem. The blood is not flowing through the heart appropriately. It's blocked. A blocked artery is what prevents the oxygen-rich blood from reaching a section of the heart. If the blocked artery is not reopened quickly, the part of the heart normally nourished by that artery begins to die. So you can have a heart attack and not be in cardiac arrest. So what happens in cardiac arrest? This is an electrical problem. Cardiac arrest is triggered by an electrical malfunction in the heart that causes an irregular heartbeat, or an arrhythmia is what we would call it, with its pumping action disrupted. The heart cannot pump blood to the brain, lungs, and other organs. So understand that whether or not it's a cardiac arrest or it is a heart attack, there is a lack of blood flow and oxygen to vital organs. The heart attack is to the heart itself. The cardiac arrest is to the brain, the lungs, and other vital organs. Okay? The reason I wanted to take the time and go through the difference between cardiac arrest and heart attack is because remember I said this is an introduction to what we're going to talk about next week and maybe the week after. But we're going to take it and tailor it for African American women. Okay? So you'll understand when we make these personal to that group of people, you'll understand the differences. All right? So with a heart attack, I'm going to go through and tell you what happens. So, symptoms of a heart attack may be immediate and may include intense discomfort in the chest or other areas of the upper body, shortness of breath, cold sweats, and or nausea and vomiting. More often, though, symptoms start slowly and persist for hours, days, or weeks before a heart attack. Really? Yes. Unlike with cardiac arrest, the heart usually does not stop beating during a heart attack. The longer the person goes without treatment, the greater the damage. Okay? So when we focus on women and heart disease, we are going to concentrate on them having a heart attack and cardiac arrest. So I just got through telling you the symptoms of a heart attack. Now, can you see why women have had an increase in the number of deaths from heart disease? Uh, I'm nauseous. It must be something I ate. Um, um, I've worked too hard today. They could shake it off as, well, let me say this, and I'm just going to be for real. Many times, a woman will have some symptoms, and I hate to say it, but it's the truth. Oh, it's anxiety. It's anxiety. Or you're having a panic attack. Come to find out she's having a heart attack. Well, how long has this been going on? Well, you know, do you have small children? You have stress. You have this, that, and the other. Okay? But she could be having a heart attack and it's ignored. But because of the American Heart Association's initiative since 2004, I think it's awakening, an eye opening thing where now women are dying more than ever. 1 out of 3 can't play around anymore. Okay? So I think things are changing. So we are going to talk about um, more specifically. I also want to talk about culturally. I want to talk about the fact that sometimes we are our own worst enemy, right? I want to talk about how our religion, because is this not a spiritual, healthy, enlightening mandate ministry? I want to talk about how we will ignore things because we know my God, my God, my God is able and he will heal us. And I know that God is not going to allow me to go through no more than I can bear. So I'm going to ignore my symptoms. I'm going to ignore this because I'm just going to go lay down and die in my sleep and never wake up again because I ignored the warning signs because I had faith, my faith in God. Do not, and wait a minute now, let me go back and say this. I believe God to be a healer. I know what God is able to do. But God said he did not want us to be ignorant either. Yes, when in doubt, check it out. Find out so you'll know. And then believe him to heal you. Heart attack can precede a cardiac arrest when there is no electrical conduction in the heart and the heart stops. You do not want that to happen. But if the heart muscle dies to the point where the the electricity going through the heart says, you ain't coming up in here. You ain't coming through here. I'm not letting you through. The heart will stop. And that is a cardiac arrest. Okay? Well, like I said, tonight, short segment, just an introduction as to what we're going to talk about next week and the weeks to come. I hope and pray that this has been a blessing for those of you who did not realize that February, it's this is kind of funny to me, right? February, it's Valentine's week, month, right? That's where we show love, and we have all these beautiful red hearts. But it's also Heart Healthy Month, and it's also Black History. So, those of you who have a sister, a queen in your heart for the month of February, celebrate them for who they are, the women that they are. And also take the time and find out how they are really doing, not just surface on the outside. Cause I'm gonna tell you now, we gonna look good if we can look good. Don't mean that we're doing well on the inside. Are we stressed? Are we on the verge of having a heart attack? Are we living with undiagnosed heart disease? Something to think about. The risk factors. Did the doctor tell us years ago our blood pressure was too high, but you decided that as long as I can't afford to be sick, and as long as I don't have chest pain, I'm good. Well, by the time you have chest pain, it may be too late. It may be too late. So we're going to talk about that. But I do pray that this brief time that I am sharing with you tonight will prompt you for next week. Hopefully, I won't be stuck in a hospital waiting area, okay? But the work that I do for Christ must come first. And taking care of God's people is number one. Obedience to God is number one. SHEM 2, I thank you, Lord, for strengthening me to carry out this ministry and to continue to do so. But my obedience to God is my pleasure to Him. We love God. We need to show it. This is that month. Thank you, Lord. All right. Well, God bless each and every one of you. Love you. And we will see you